Working with hundreds of clients, I've noticed that traumatized individuals experience physiological symptoms such as chronic migraine, back pain, digestive issues, heart problems. Without understanding our physiology, we cannot regulate our body and mind. We suffer due to lack of self-awareness. Today, I'd like to give you an actionable tool to understand and raise your awareness around your body and your mind. Let's dive in. Welcome, my name is Hong Jung. I'm a licensed therapist based in Los Angeles, California. This is our virtual therapy session 2 on how to overcome childhood trauma. In our session together, I prepare a set of questions to ask you. So please pause the video and give yourself enough time to process and digest each question. First things first, let's review. I prepare a few questions for you to review your progress based on the first session we had. So please pause the video and take your time to review your progress, and I prepare a question in the down description box. So give yourself time here. Well done, well done. It is important to check in with yourself on a regular basis and notice your progress as well as room for improvement. I like to stress the importance of skill building for your self-regulations. It's like you want to collect tools and skills to build a car or build a house. And I'm here to give you information and tools, and you take this information and tool into your own creative actions. Alright, our brain controls fundamental body functions such as breathing, blood pressure, heart rate, etc. Our body also sends signals to our brain and vice versa. So for instance, my stomach doesn't feel good, then my brain will release hormone to reduce pain or help digest better or make me puke. So my brain plays a role like a pilot and my body is like an airplane. Our brain is a very complex organ. So to simplify it, there are 3 parts: reptilian brain, limbic brain, neocortex. Reptilian brain is located at the very bottom of our brain, is connected to many nerves in our body and control vital functions such as heart rate, breathing, and so on. When our heart rate goes up, the reptilian brain receives information and sends it to our limbic brain. The limbic brain is in charge of emotions and memories. Let's say my stomach doesn't feel good, my limbic brain will trigger fear and thinking about what I ate for lunch. And then neocortex, the higher brain, will go into problem solving. Oh, I had a milk today. I need to check in the expiration date on the milk. Or I need to take Pepto-Bismol to settle this upset stomach. Reptilian brain, limbic brain, and neocortex work together, protect and preserve our body. With that in mind, let's talk about our brain and our body function when we're under threat or when we feel traumatized. There are 3 types of survival responses in the face of perceived threat. The first one is the most sophisticated response, so-called social engagement. When we face threat, we are able to use pro-social behaviors such as negotiating, brainstorming ideas with others, validating others' feelings, and so on. Through pro-social behaviors and positive social interactions, we are able to connect with others. We're able to read nonverbal cues such as facial expressions and gesture to find whether we're in danger or we are safe. So this is the most ideal survival response because we're a social creature. We need each other to problem solve and feel validated and safe. When we are fully using social engagement, we have a calm body, as evidenced by resting heart rate, slow and steady breathing, and relaxed muscle. When social engagement is not an option, we go into fight or flight response. It is very primitive response. If we encounter a tiger, we either fight the tiger or flee from the tiger. In this response, we become hypervigilant for everything and anything because it is life or death situation. It is either kill the tiger or to be killed by the tiger. And of course, it is hard to engage with people in this response because our only option is fight or flight. So social engagement goes out the window. In addition, fight or flight response stimulate our body. We can often have high blood pressure and high heart rate. And of course, our breathing gets rapid and our muscles get tensed up. Almost like a ready for action. Our body gets ready for action. We have to fight the tiger or flee from the tiger. The last survival response is freeze response or shutdown response. It is very helpless response. Let's say someone is out to get you and you're held in a very confined area such as car or airplane or in the bathroom. We feel trapped in fear. The helplessness and fear due to being stuck, being immobilized can lead to decrease in heart rate, blood pressure, muscle tone, facial expression, voice, and immune system. So in this response, we slow down our physiological functions. So we feel numb or dissociate from reality, so-called out-of-body experience. We are experiencing death almost. The important note here is that these three survival responses come with different physiological state. Heart rate, blood pressure, and breathing, the muscle tones are the big indicators of what state, physiological state you're in. And our physiological state is governed by autonomic nervous system. The autonomic nervous system sends signals to our brain which evokes different state in our body. Then our response follows suit. This whole autonomic nervous system process is involuntary and is automatic. One analogy I like to use is a Pokemon. Let's say I'm under threat and my body automatically can turn into fire type Pokemon, which is a fight or flight response. My body can turn into water type Pokemon, which is freeze or shutdown response. And then grass type of Pokemon is like a social engagement. Depends on your survival response, your body will turn into a certain physiological state accordingly. So what now? What can we do with this information? Let's monitor your physiological state and your survival response. While our autonomic nervous system involuntarily evoke different states in our body, we can monitor our sensation, emotions, thoughts, and urges to identify which survival response is being activated. Let's say I am noticing increased heart rate, anger, negative self-talk, and urge to yell. It is safe to say I'm in a fight or flight response. To monitor our survival response better, we're going to use the Watch the Mind Train exercise that we did in our last session. So if you're not familiar with this exercise, please watch the previous session. The format of our virtual therapy sessions is to build skills and raise self-awareness in gradual and steady manner. Let's practice together. I want you to find a quiet and safe and comfortable place to sit or lay down. And I want you to close your eyes partially or fully and notice your breathing. Notice your sensation in your body. And then slowly think about mildly stressful or uncomfortable moment that you had recently. We are trying to identify your triggers. But let's think about one particular moment that you felt triggered. And then slowly visualize train tracks and you're right in front of it. And each train is passing by with many cargoes. So with that trigger, let's first bring up the sensations. How was your heart rate? How was your breathing? Any tension or relaxation in your muscles? How was your voice at the time? What were you looking? What was the body temperature at the time? And then let's notice your thoughts. What were you thinking? Did you have any negative thoughts? Or positive thoughts? Or neutral thoughts? Were you thinking about yourself? Were you thinking about others? Were you thinking about future, present, or past? When you notice sensations in your body and your thoughts, what emotions did you notice? Did you notice anger, frustration, fear, sadness, grief, excitement, and joy? Let's notice what emotion you had with that particular trigger. And then let's notice your urges associated with trigger. Did you have urge to yell? Did you have urge to run away? Did you have urge to talk to people and negotiate? Did you have urge to give up or try harder? Let's notice your urges with that trigger. And then attach your sensations, your thoughts, emotions, and your urges to cargoes and let them pass, and seeing them going away. There we go. Notice that. And now let's identify your survival response you experienced. Is it fight or flight response? Is it freeze or shutdown response? Or is it social engagement response? Let's notice that. The last question is this response effective or ineffective? We're accessing your higher brain function to put it into perspective. Is your survival response is the best option? Or do you have other options? Let's say I want to argue with my wife because I think she's cheating on me, and I want to yell at her and argue with her because I want to use my fight response. Is this the best option? Or is there a better response to express my feelings and my thoughts and handle the conflict in my marriage? Instead of yelling, can I use neutral tone of voice? Or can I stop the conversation when the conversation leads off in a negative or accusatory way? Can I resume the conversation when we both feel calm and ready to talk again? Let's find your reason to go with that survival response or not to go with that survival response. And how are you feeling now? How did you like the exercise? Please leave a comment down below. There you have it, the 3 types of survival response. The secret of self-regulation is awareness. Without awareness, there's no self-regulation. I strongly believe that self-awareness through this exercise will restructure your brain in a positive and resilient way. So take care of yourself and do your healing every day.